Okay, let's finish with anticoagulants on here. Page 48.
This one?
Yeah, page 48. Okay, anticoagulant therapy. It says prevent proper clot formation. We know that's what we want to do. So adverse reactions for any anticoagulant is going to be bleeding. Okay, work too much, make you bleed too much. Urine may turn red and orange. Feces may turn red or black. That usually means that there's blood in them. Okay, and that's not good. So need to quit taking the medicine and call the doctor. A warfarin injection must be protected from what? So we can't give warfarin by injection. Those. Oh, down here it just says tablet. So anyway, patients should avoid foods rich in vitamin K. We already talked about this. Remember, they don't need to. They can keep their same amount of vitamin K in their diet, like salads, green leafy vegetables, anything that has vitamin K. But they don't want to like go overboard one day or not take as much one day. They just need to kind of keep it steady so that they can know how to dose their medicine. Many drug interactions occur with warfarin. We know that sometimes. Says mefetin is given to treat that, but it's a vitamin K injection. Blood clotting must be monitored through prothrombin time or international normalized ratio testing. That's the PT and INR. And then heparin, you give it IV or sub-Q. Don't give it IM. And then you use that protamine sulfate if they overdose on heparin. Too much heparin. And I'm not saying overdose like they're going to take too much. I mean, they get too much, they're bleeding, too much, and then go from there. Enoxaparin, there's the Lovenox. It's on here, sub-Q. Enoxaparin or Lovenox. Heparin is IV, and then warfarin is the Coumadin. Okay, antiplatelet agents interfere with chemical reactions that cause platelets to clot. So specifically on here is your Plavix that we talked about. Aspirin is another one. That's why a lot of people take a baby aspirin every day, okay, to help prevent blood clots. This is why. So it's a normal regimen. And then Plavix, like it says, is another one that does that. So that was on our list this week too, wasn't it? The last week one. Okay, so that's anticoagulants. Now, flip back over one more time. We're going to do respiratory system. So page 9 on your PowerPoint, it says pharmacology and the respiratory system. Okay, so respiratory system. Upper respiratory tract infections, which we all know what's the difference in upper respiratory, everything larynx and up. Okay, lower respiratory is trachea and down. So upper respiratory tract infections are more common than lower respiratory tract. That's because there's so many, mechanisms of how to, like, trying to keep bacteria infection out of the lower respiratory system. They can be caused by viruses, bacteria, or people can have fungal infections. Okay. Antihistamines, drugs that counteract the action of histamine are called antihistamines. So specifically this kind likes for allergies, like, nasal congestion, sneezing, all that kind of stuff. These are histamine, H1 histamine receptors. Now I talked about H2, which we'll go into detail. Those are the kind that are in the stomach, like to prevent too much acid. Okay, but H1, these are like your normal allergy medicine. Antihistamine is what you'll see in written as. Second type used for peptic ulcers, like I said. Okay, antitussives. These are agents that relieve or prevent coughing. And they're classified into two major groups. You have opioids and then your non-opioids. Okay, obviously your opioids are going to be the ones that are on your scheduled list. Remember we talked about there are some Schedule 5s that have a little bit of codeine in them for coughing. Okay, those are your opioids. Those are the ones I was talking about. And then you have your other ones like Robitussin. Okay, see the tuss part in there that tells you it's a cough medicine. Those are nasty. Steroids, which we talked about earlier this week, some already. but they're the most potent, it says, and effective anti-inflammatory agents that we have. So they work against inflammation. Administration, it says, with a metered dose inhaler is often accomplished, 1 or 2 puffs. So you have an inhaler, we know that. And then a dry powder inhaler delivers medication in the form of powder. That's like, there's some medications that people take, like Advair, for example. You've ever seen those purple discs, or at least commercials for them?
Yeah.
Okay, it's got powder inside of it, and that's what they actually breathe in.
I think I have one.
It's a combo medicine that's got both in it. Spiriva is another one. I think Spiriva is the one that it has a little capsule, and whenever you close it, it like crushes. It doesn't crush it, but it like breaks it open, a little capsule, and then you breathe in that powder for the medication part too. So that's what it's talking about. Examples of these: beclomethasone. And you can usually see these. Okay, some tells you that it's a steroid, that zone at the end, like dexamethasone or Decadron, methazone, fluticasone, prednisone. That clues you in that it's a steroid, that zone at the end. Okay, so all of these are pretty commonly. Flovent is an inhaled one, specifically. I think Pulmicort is an inhaled one. But now prednisolone and prednisone, these are oral medicines. So is Decadron. We used to give Decadron when kids had croup. They would come in with croup, which is like a really inflamed. You can see it on an X-ray. If you take an X-ray of like their trachea, it will look. They call it. It's like they call it the steeple, and their trachea will be like narrow like this. Okay? And so croup is not something. We listened to some croupy coughs before. They sound like seals. It's like a bark almost. It's a really strange sounding cough. I'll try to look that up in a minute. But it has very distinct sound to it. Anyways, but it just takes like 1 dose of dexamethasone, and they take it and go home. It's usually caused by a virus, but you want to get rid of that inflammation because the trachea is so narrow. So here, I'll see if I can find that. Well, or otherwise I'll forget if I wait till the end. Here we go. This one's a good one. Now air, remember, usually comes up black. So see the trachea right here and how it narrows? See that steepling kind of effect? How it really narrows there? Go to another one. Same thing here. You can see it right here. See how it's narrowed?
That'd be horrible.
See it? So yeah, croup is not something you want to play around with if you can tell that that's what it is, you know. It's got a close up, looks like. Oh, it's not really. Oh, there it goes. See it right here? Yeah. Well, let me see if I can find. YouTube video. Let me turn that up. Stridor is a respiratory sound that you hear that usually means that they have some kind of like blockage in their throat particularly. So it's a really loud respiratory sound, not like your normal sounds that you hear in the lungs. Hearing, breathing really loud, that's stridor. Kind of wheezy sounding, but it's loud. think it'll show a cough again. I feel like I've seen this one before. See how also on his, see how it's kind of sucking in down here? And a lot of times they'll do that up here too. That means they're having, those are called retractions. And that means that they are having difficulty breathing. I mean, that clues you in that it's like, they probably need medicine. They're struggling to breathe. So I think they're showing the retractions. Usually the higher up the retractions are, the worse it is. Like kids with asthma will get retractions too. They've been way up here, and those, that usually clues you in. It's the higher it is, the worse it is. I really want to hear the cough again. Let me just go back to the beginning. They kind of sound like a bark. Anyway, that is kind of a hallmark creepy cough. It sounds like a bark. It's real dry. There we go. So, anyways, that's croup. That's Decadron is what you usually get for that. But anyway. Okay, bronchodilators. So bronchodilators are agents that widen the diameter of the bronchial tube. So they're trying to enlarge it if they've been really constricted because of inflammation, asthma, whatever. It helps to open them up, hence the word bronchodilate. So beta adrenergic agonists kind of work opposite of beta blockers, like we said earlier. Theophylline, anticholinergic drugs, those are those peripheral nervous system drugs we talked about, and then xanthine derivatives. So albuterol is kind of like your standard, somebody who's having an asthma attack, albuterol is going to work quickly, open up those bronchial tubes, bronchi. And these kind of, this one doesn't, but this TEROL, that's a clue that it's a respiratory drug, that it's going to work to, it's going to be a bronchodilator. Ceravent, the vent in there, like a ventilator, Proventil. And then these xanthines, theophylline, an example of that same way. These open up the bronchial tubes. Anti-tubercular agents. So these are medicines that are for tuberculosis, which we know is a lung disease. Okay? It's an infectious disease. Tuberculosis is more prevalent in people with AIDS because their immune system is already down. People who abuse drugs, again, the immune system is down and it's easily passed. And then homeless shelters and nursing home residents, a lot of times the people who test positive for tuberculosis, you know, they are homeless. I don't know if it's just because of the, I don't really know if it's just because they're outside and their immune system's down because of nutrition and shelter, and they're usually around other people. I'm not exactly sure the reason for that. Though. Primary anti-tubercular drugs, isoniazid, I'm not saying that wrong. Ethambutol, I've seen rifampin. Rifampin actually turns urine, sweat, saliva orange.
Right, it's gross.
So that's always something to tell people if they're going to take rifampin. When they pee, it's going to be orange. Some will freak people out if they don't know. Or under their arms, if they're sweating a lot, it's going to be orange.
Right.
Kind of like those Gatorade commercials, you know.
It's probably the date.
Streptomycin is an IM medicine that people take. I don't think that they use streptomycin. We used to call it strep. But anyway, I may be wrong, but I don't think that is necessarily recommended one. But I could be wrong on that. So don't quote me. Streptomycin is still listed as that. Okay, let's look at your other paper again. flip back over to this one. Go to page 34 first. Where we see the antihistamines, antitussives, and decongestants. 34. Okay, so our antihistamines, indications, allergies, insomnia, rashes, hay fever. Some of these are used for dizziness, like vertigo, and then some prophylaxis for drug reactions. So if they think that they're going to have an allergy to it or could have, then they might use this. Like vancomycin, remember I said it causes that red man syndrome. Sometimes they'll give like an allergy type medicine like Benadryl with that to help decrease that red man syndrome. Adverse reactions, drowsiness, we know Benadryl makes us sleepy, right? Anticholinergic reactions like drying up of the body fluids. So nose will get really dry, mouth may get really dry, because that's one of the reasons that it's working, is that it's trying to clear up congestion. And then possible hyperactivity in children. So Benadryl, even though for us it kind of makes us sleepy, a lot of times in younger kids, it might make them a little hyper. Opposite, kind of like we talked about with Ritalin and Adderall, they have the opposite effects on adults and kids. Antihistamines have a synergistic effect with alcohol. That means if they make you really sleepy, alcohol on top of that is going to make you really, really sleepy. So Benadryl and alcohol don't mix very well. None of these do. Antitussives, let's go up, actually look at the antihistamine meds on the right-hand side there. Cetirizine is your Zyrtec. And we know that's an allergy medicine that's really common. Diphenhydramine, you see that is Benadryl. You need to know both of those names for sure. Diphenhydramine, I promise you'll see that on Pass Assured. And it can be given IV. It can be given, it's like usually comes in a little pink pill. So that's Benadryl. And a lot of times, if you look like at Tylenol PM, the other ingredient, the ingredient in there that makes you sleepy, it has acetaminophen. It also has diphenhydramine. So that's what, Tylenol PM, acetaminophen and diphenhydramine, which is Benadryl. Allegra, fexofenadine, hydroxyzine or Atarax. A lot of times that is used for itching. It can be used for allergies too, but people will give it, like if there's a specific, like sometimes morphine makes people itch really bad whenever they give it IM, so they may give them something like that too to help prevent that. And it's like I remember there was some medicine I got that made me itch, and it's like a come out of your skin itch. It's like a just itch all over, uncomfortable. It's really weird. Loratadine is Claritin. You'll see that one. Claritin is given. And then promethazine, notice down there at the bottom, that Phenergan. That is given for nausea or sometimes like motion sickness. People will take it. So that's a very commonly prescribed drug. Zofran is not, but I think Zofran is a different type of class of drug. Anyway, it's just an antiemetic. But this Phenergan is given for nausea very frequently. Makes you really sleepy. Okay, antitussives. We know we want these to help get rid of the cough. So adverse reaction, CNS depression. Hence the reason a lot of people will take cough medicine and abuse it. Okay, they'll use it as drugs. That's why there's all those rules now on what age you have to be to buy cough medicine, because people have abused it. Nausea, lightheadedness. I think they even have to keep it behind the counter now. Even though it's an over-the-counter drug, I think they have to keep some of these at least behind the counter. I'll have to look at the rules on that. Dextromethorphan interacts with MAOIs and benzonatate. That's the little pearls. In a minute, those need to be swallowed, but you don't chew them up. Dextromethorphan, okay, DM. If you've ever seen Robitussin DM, okay, that DM is this dextromethorphan. It's got that medicine in it. Anything with DM on it. And if you'll look down here at the antitussives, benzonatate, these look like little pearls, like little white, clear looking medicine that you take for a cough. That DM, again, can come in syrup or lozenges. Yeah, okay, decongestants. Mechanism of action, they stimulate alpha-adrenergic receptors and constrict the arteries that are in your nose. So when your nose gets really congested, those blood vessels have dilated, okay? And we talked about how thin that membrane is. You know, we talked about that Tuesday, I guess, in anatomy. And so when those blood vessels dilate, it's going to cause congestion in there. So these work to decrease that. Adverse reactions, CNS stimulation, increased blood pressure. Okay, so people who have hypertension, Sudafed is not a good medicine for them to take, especially if they're really battling it. Now, if it's under control, it's a different story. But increased heart rate can cause insomnia, hence the CNS stimulation, anxiety, tremor, all that kind of relates to each other. Decongestants should be avoided if they have diabetes, heart disease, hypertension, hyperthyroidism, prostatic hypertrophy, or Tourette's, okay, which is another stimulant type disease. Stimulant disease. Examples of these are your pseudoephedrine. Pseudoephedrine sounds a lot like Sudafed. Those are the same thing. Sudafed's a brand name. Okay, so pseudoephedrine. If you see that word, even though it looks kind of crazy, sound it out. It sounds just like Sudafed. So that one's specifically for somebody with hypertension. You don't want them necessarily to take it. And then there's some of these that have a combination, like cetirizine and Sudafed, Zyrtec D. It's got that decongestant in it. Okay? That's why that D is on the end there. Expectorants, these decrease the thickness of mucus so that they can like cough it up, spit it out. Okay, that's an expectorate means to spit. So if they say expectorate into this cup, that means they want you to spit into a cup to culture it or whatever. Nausea, vomiting, drowsiness, GI distress, lots of water. Okay, guaifenesin, probably seen that too. Sometimes you see Robitussin and guaifenesin together. Or Robitussin is guaifenesin, sorry. You'll see them, both of their names on there. And then combination, again, Robitussin AC has the codeine in it. And then Mucinex D is an example one that has that decongestant in it. Mucinex is an expectorant. So people take it, that's what it does. It tries to thin out all those respiratory secretions so they can be spit up. Okay, so that is that for those. Now skip on over to page 38 in that packet. I'm going to finish up the rest of these respiratory medicine. Okay, asthma. That's inflammation in the lungs that causes the airways to constrict and is characterized by wheezing, dyspnea. What is dyspnea? Yeah, difficulty breathing, and then a cough. Okay, so we know bronchodilators. Look at the adverse reactions. CNS stimulation, remember we talked about it kind of makes you kind of hyper feeling, increased heart rate, tremors, palpitations, their heart rate will go way up. Arrhythmias, tachycardia. Patients may over-medicate to control. Ipratropium needs to be protected from light. Salmeterol needs to be stored at room temperature. Don't want any of this to freeze anyways. Albuterol, like I said, looked at these on here, but again, look at your keywords. Atrovent, clues you in that it's a bronchodilator. Cumbavent, Max Air, okay, it's respiratory medicine. Ceravent, breathing, okay, breathing sounds like breath. Spiriva, like inspiration. Okay, so read it, think it through whenever you see some of these medications. These xanthine derivatives, you have theophylline, that one's pretty commonly prescribed. Look, these are to reverse bronchospasm associated with antigens and irritants. Treat lung disease that's unresponsive to other medicines. So bronchodilators aren't working, they can use these as xanthine derivatives. Blood levels need to be maintained, so they're going to watch that. And look, it may interact with macrolide and fluoroquinolone antibiotics. Leukotriene inhibitors, this is for, like it says, prophylaxis and long-term treatment of asthma. So Singulair is kind of the main one on here. So that's a tablet that people take but it's a long-term medicine. It's not like if somebody has an asthma attack, they can take their Singulair and expect to get better. And this is a medicine that you take over time. Steroids we just talked about. Flovent, Advair is another combination steroid drug. Like we said earlier, that's the one with the purple discus. Flonase. That one is on here. I've seen that one at, oh, maybe it's not. I think I've seen that one as a nasal spray too, Flonase. Anyway. That's it. Mast cell stabilizers at the bottom inhibit inflammatory cells. So this is just for prophylaxis. I mean, this is not going to help in an asthma attack either. Prophylaxis, remember, is to prevent. So like airway passages must be open before the use. So you use a bronchodilator first, and then you use these. Advair discus, like I said, that's the combo product. So. Okay, emphysema, characterized by the destruction of tiny alveoli, walls, or air sacs of lungs. That's where they lose their ability to like stretch and bring back in. Okay, the way your lungs work is muscles actually open up your lungs, but the elasticity of your lungs is kind of what pulls them back in, and then the negative air pressure sucks it back in. Okay, well, when you have emphysema, it's kind of lost its ability. It's like a rubber band that's been really stretched out and doesn't like shrink back to its normal size. Major risk factors are cigarette smoking, air pollution, occupational exposure, just long-term exposure to irritants. Bronchitis is an obstruction of airflow during expiration. May be caused by cigarette smoke. Same ideas. A lot of times people who have asthma for a really long time kind of turns into chronic bronchitis. Characterized by a cough that produces a purulent, green, or blood-soaked sputum. They usually cough up lots of stuff. Lungs' defense mechanism has been destroyed, so they have lots of mucus. Okay, and they're just constantly like coughing it up. You probably heard people like this. They're like, that person has COPD. You can usually tell because they're just like constantly. Y'all know people who like hack and cough stuff up all the time. I'm not telling them you need to tell them that they have COPD, but you can know that in your head. And you may tell them they need to see a doctor, but. So look, there's an excessive mucus expectoration with at least 30 milliliters of sputum every 24 hours for 3 months. That's a lot. Mucolytics are used, so try to break up that mucus. Cystic fibrosis is says fatal disease involving the GI and respiratory system. And they have lots and lots of mucus production as well. They have to have like treatments where they'll like put on a vest and it kind of like shakes doesn't really shake them, but it's like vibrates and tries to knock loose mucus. So mucolytic agents break apart that mucus, so makes it a little bit thinner and easier to actually cough up and remove. Mucomist has an unpleasant odor, and a lot of people don't want to use it. But mucomist, mucus. Tuberculosis, fever, night sweats. Those are kind of your night sweats is kind of like a hallmark sign of tuberculosis. Fever for sure. A cough that eventually will become like they'll have like bloody sputum. Loss of appetite, weight loss. Usually they lose a lot of weight, and the problem with treating this is it's not like, oh, you take antibiotics for 10 days and it's better. It's like you take medicine for 6 months. Okay? It takes a long time to make it better, and it has to be monitored, the medication does. Look, asymptomatic patients, so no symptoms, will receive I'm not saying that right, INH is how we usually say it. So INH daily for 12 months. Patients with symptoms are treated with at least 2 different medications. So that INH is on there, and then rifampin, like I said, urine and sweat turns kind of a reddish color. Smoking cessation. We know why we don't want to smoke, but look, Nicoderm, Nicotrol, Nicorette, Chantix, all these are medicines that are used to prevent, to help people quit smoking. And that is it. One day of lecture today.